Good afternoon, one and all. So, we are here yet again with another topic at Talk Evidence at Ayurveda. So, the topic for the day is Piccha Basti, a promising classical Ayurveda intervention in the management of recurrent ulcerative colitis. So, the terms Piccha Basti and ulcerative colitis are very much familiar to all of us. So, without much delay, I'll get into it. We have with us today Dr. Annie. Her full name is Dr. Annie Sambal. She is very much familiar to us. She is the medical superintendent and senior physician at AyurVAID Hospital, Kadavendra. Okay, and she has completed her graduation from Vaidyanathan Ayurveda College at Thrissur, and her post-graduation and diploma in Wellness and Health Science from Annamalai University. She has also completed her yoga instructor's course from S. Vyasa University, Bangalore. She had served as a senior medical officer at Chandigiri Ayurveda and Siddha Hospital, Ernakulam. Currently, she has been with us for more than 22 years, and she has been a part of the Ayurveda family, and she is serving as a senior physician and medical superintendent at Ayurveda Hospital, Kattamendra, and Aster Ayurveda Center for Integrated Medicine at Kochi. So she has under her belt a experience of over 2 decades, and she has been providing holistic physical and mental therapies to people of all ages. And she's an expert in managing gynecological metabolic syndrome and various other weight loss programs and nutrition. And next, we have with us Dr. Bindu. She has completed her graduation from Vishnu Ayurveda College, Shornu. She is currently a physician at Aston Ayurveda Center for Integrated Medicine and has been associated with Ayurveda since the last 8 years. So she is very well known for her calming aura, therapies, and ability to guide the patients through a healthy lifestyle and diet has earned her acceptance from a without much delay. I hand over.
Thank you, Dr. Sally. Good afternoon, all. Today we are presenting a case of chronic ulcerative colitis treated with 21 days of IV treatment. The patient was 31 years old, male, college lecturer, came to AVHE all the way from Pondicherry. After treatments, we got a very good outcome in terms of symptoms, and the patient still continuing medicines and diet at home for complete cure of his ailment. So Dr. Bindu will be presenting the case.
Good afternoon all. I will start with presenting complaints. Presenting complaints are multiple loose bowel movements with blood and mucus, painful defecation, burning sensation while passing bowel, abdominal pain after taking food, fatigue, tenesmus, gas formation, incomplete evacuation, heartburn. Then relevant
Bindu, can you ensure your face is in the screen, please? Because you're not visible otherwise, please. Yeah, that's better. Yeah, thank you.
Then coming to relevant history, History SP complains of pain and burning sensation during defecation, blood and mucus along with stool, abdominal colicky pain, fatigue, tenesmus, and gas formation since 2 years. Symptoms started slowly as frequent motion and gas formation, later into blood in stool. He was on allopathic medication, that is prednisolone, folic acid, and mesalazine sachet for the past 2 years. Prednisolone was stapled to 10 mg after 6 months and 5 mg after 1 year. Then he stopped all medicines in June because all the symptoms had come down. After that, the symptoms got aggravated and became 20 bowel movements per day with severe colicky pain, blood and burning sensation. Due to his impending marriage, he had restarted the medications with a higher dose in the last week of July. The symptoms have started affecting his daily activities and quality of life. So he has approached Ayurveda Hospital, Kadavandra for the root cause management on 30th August 2021. General findings were bowel, loose bowels with blood and mucus 4 to 6 per day. Bladder was normal, appetite Vishmagni, sleep was good, stress was high, Ojas Madhyama, BP 130/80, pulse 72, height 173 centimeter, and weight was 67.4 kg. Family history, no relevant illness revealed. He was not allergic. And the treatment history and current medication, prednisolone 20 mg once daily and folic acid once daily. Mesalazine sachet thrice daily. And coming to the Ashtasthana Dashavidha Pariksha, Nadi was Sadharana, Mutra normal, Mala Nirama Adi, Jihva Ubalipta, Shabdam Sadharana, Sparsha Mushna, Drik normal, Akriti Madhyama Kashne. Dosham Vada Pitta Pradhana Tridosha, Dushyam Rasa Rekta Mamsa, Desham Anugam, Balam, Rogabalam Pravaram, Rogibalam Madhyama, Kalam Jirnam, Pragradi Vada Pitta, Analam Vishamagni, Vayas Yovanam, Koshta Mrudu, Rogamarga Abhyandaram, Sattva Madhyama. Clinical examination for abdomen, tenderness plus over left lumbar and iliac region. Cardiovascular and respiratory systems are normal. Per anal examination, no external pile mass, tenderness plus, no perianal abscesses. Coming to the Nidana Panjaga, Aharaja Nidana, excess food intake of more salty, pungent, sour, hot, alkaline foods, and intake of more fried non-veg foods. Viharajam, overexposure to hot wind and sun. Manasigam, anxiety, stress, anger, depression. Purvarubam, Samanya Purvarubam, anemia, abdominal pain, weight loss. Vishishtam, loose bowels with blood and mucus, burning defecation. Upashayam, light foods. Samprapti Khadaga, Dosham, Vada, Pitta, Pradhana, Tridosha, Dushyam, Rasa, Rekta, Mamsa, Dushti, Agni, Jadragni, Rasa Dhatwagni, Rakta Dhatwagni, Ama, Sama, Srodas, Annavaha, Purishavaha, Udakavaha, Rasavaha, Rektavaha, Mamsavaha, Srodo, Dushti Pragaram, Sangam, Adipravati. In the Samprapti flowchart, due to Nidana Sevana, initiation of Pitta Pradhana Tridosha occurred. Here, Manasika Nidana leads to Agnimandya and Pitta becomes Sama Pitta, which vitiates Dhadus, and Dosha Dhadu Samurshana and Sanjaya in Pakvashaya, which leads to Annavaha, Purishavaha, and Udagavaha Srodo Dushti. This breaks the stools due to its hotness and fluidity and leads to Pitta Adhisara, that is, loose stools with burning sensation, pain, and thirst. And again, intake of Pitta vitiating foods and drinks that causes the vitiation of Rekta Dhadus and got lodged in Pakvashya and precipitating. So, Shula, Shodha, Adhisara, Vrana, and Rektasrava. And also vitiating kapha blocks the channels, causing further inflammation and mucus accumulation and edema. This leads to Rektaja Adhisara. Then coming to the lab imaging test and their conclusion. His mucosa of rectum, sigmoid colon, and descending colon are edematous, erythematous, loss of vascular pattern, and friable mucosa noted. Biopsy was taken. It shows the colonic mucosa with a focal ulceration exhibiting glandular disarray, cryptitis, cryptabscess, which are features consistent with ulcerative colitis. CSR was 8 and HB 11 and CRP 10. Electrolytes, LFT, and the urine analysis were normal. Differential diagnosis, Crohn's disease. It's a severe type of IBD which causes inflammation of digestive tract, which can lead to abdominal pain, diarrhea, constipation, fatigue, weight loss, and malnutrition, with severe complications like fistula, perianal abscess, fissure, anemia, and other systemic diseases. Can affect anywhere in the GI tract, but mostly in lower part of small intestine. It tend to affect the pain in lower right side of abdomen. Ulcers penetrates the entire thickness. It was ruled out as there was no strictures, no fistulas and fissures, no rectal and perianal diseases, and by assessing the location of pain and inflammation. And infectious colitis, inflammation of large intestine caused by viral, bacterial, or parasitic infections. Symptoms are tenesmus, wavy abdominal pain, build into diarrhea, mild fever and chills will be there. In severe cases, blood will be there in the motion. It was ruled out by laboratory stool test done before, in which bacterial or viral pathogens were absent. And here the patient was having chronic mucosal changes, which will be absent in infectious colitis. The confirmed diagnosis is Rectaja adhisara, ulcerative colitis. The treatment principle was, the basic treatment principle is to be considered during treatment is ama and pakwa features of the patient. Agni Dipana, ama pajana, grahi, stambana, dadu poshaka, Saptajaya Chikitsa is to be adopted by monitoring the condition of the patient. The internal medicines given were Manasamitra Padaga, Dadimastaka Churna, Kaidariadi Kashayam, Dhanandaram tablet, Drakshadi Kashayam, Alsan syrup, capsule point, then some preparations like top of Dadima Bhala, flowers of Dhadagi, dried ginger, Shadavari, and the Rekta Chandana boiled in water. That is for drinking frequently. Black sesame seeds and sugar candy with goat milk twice daily in empty stomach. And Charnieria the Grada was given as infusion through anus. The treatments done were Takradhara, Snehapana, Bahya Sneha Svedana, Mriduvirejana, Pichavasti, and Vasanavasti. Thank you. Dr. Ani will explain the detailed Chikitsa Siddhanta and medications.
In this case, initially when the patient came, he was under prednisolone 20 mg, but his appetite was very high and stool was floating. But he had some Samapitta Lakshanas like acidities or bloating, etc. So he adopted initially Dipana Pajana and Grahi drugs in the initial stage to reduce the amatva and loose motions to arrest bleeding. Along with these medicines, we have done Takradara in the initial 4 days for reducing Kaba and Pitta and to prepare for him for the impending Snehapana. So after Amavajanam, we needed to do Snehapana for him for the Shodhana procedure. So for arresting bleeding, we have given a sesame seed paste with the sugar and goat milk. 10 grams of paste 2 times with the goat milk to arrest bleeding. And a panaga, which was described before, a panaga was given with the drugs mentioned in Recurrent. So after 4 days of treatment itself, the frequency of motion bleeding has reduced up to 80%. So at the time of admission, he was on prednisolone 20 mg. After 4 days, we have reduced the dose to 10 mg because of the reduction in the symptoms. On the 5th day onwards, we started Snehapana with the Maharikta Krita. Because it was a deep-rooted chronic disease, we needed to do Shodhana Chikitsa. So we opted Maharikta Krita because it was a Pranarobhana and Pitta Shamaga property, which will be helping to heal the ulcerations and edematous mucosa of the sigmoid and rectum. So after Snehapana and Abhinga Swedanam, did a Virejanam with the Avipatti Churnam. It was a Murdu Virejanam, 20 grams. So he had 5 Vegas without a trace of blood in it, which was indicative of healed ulcers. So after Shodhana, internal medicines and Takradara, we restarted. I think we have done 9 Takradaras after that, and we have done 3 Pichavastis and 5 Anuvastis along with the Takradara. So Pichavasti is indicated in Rectadisara to check bleeding, diarrhea, and inflammation in the anorectum. Pichavasti is named so because of its pitchula properties, which means it is sticky and lubricant. Because of this property, it has an ulcer healing effect. Possible actions of Pichavasti are Shodhahara, Vranarobaga, Rektastambaga, Sangrahi, Pitta Shamaga, and Agnidepana. This enema acting as an evacuative as well as sustaining overcomes quickly the disorders of Pittaja Adhisara, fever, edema, and IBS. So in our test, Pichavasti prepared as Kodabhaga Vidhi, but here we administered a modified Pichavasti, which was very beneficial in 4 to 5 previous UC cases of ours. So we have done Pichavasti and Anuvasanavasti on alternate days. For Anuvasanavasti, we have taken Maharikta Krita. In between, the dosage of prednisolone again tapered to 5 mg and stopped all the medications at the end of the treatment. So diet given was, according to Shushra Samhita, goat milk is highly recommended. So after boiling with 3 parts of water, it is Kaba Pittahara, Laghu, and Rasayana. So we use normal shali rice for rice dual and old basmati rice for making khichdi by adding some moong dal, masoor dal, dried ginger, and vegetables. We had given boiled banana and pomegranate juice as healthy snacks. Boiled buttermilk by adding ginger and turmeric given for its grahi property, Agni Devana, and to maintain microflora in the gut. So we avoided green leafy vegetables, black gram, spicy foods, non-veg, sugar, wheat, pasta, vinegar, salty and acidic foods, and advised to avoid raw salads, supari, mango, aerated drinks, etc. So at the end of the treatment, the outcome was, we had a very good outcome. The frequency of defecation and the painful defecation, burning sensation, etc., bleeding while passing stool, etc., was very much reduced in the initial days of internal medication itself. So during Snehaparam also, there was no, after Videjanam, there was no blood in the stool. So we got an excellent outcome at the end of the treatment, as you can see. And the tapering of prednisolone is featured here. It was after 4 days, we tapered into 10 mg and then to 5 mg after Videjanam and then stopped. And we stopped this medicine because the patient had also wanted to stop the medicine because they want to start a family of their own. Yeah. And then folic acid and misalazine sachet was also there, that also tapered well. Patient outcome. Patient was very happy at the end of the treatment. And for 1 month, we have given this medicines, Kaidariadi Kashayam, Dadimastaka Churnam, Kutajarishtam, Manasmitra Vadagam, Gulishadi Kashayam, Alsan syrup, Dhanandaran tab, etc. for 1 month. And after 1 month, we wanted him to call for a review. So after 21 days of IP treatment, patient has got 90% of improvement in his symptoms. Pain, bleeding, burning has completely subsided. Frequency of bowel has reduced from 6 to 2 per day. Consistency became normal. In between the treatment, he had stopped taking allopathy medicines also. At that time, the bleeding and other symptoms slightly aggravated after 2 weeks. Then the symptoms has reduced towards the end of the treatment. On 15th October, he had called for review consultation. At that time, after he had to travel outside, hectic traveling was there. So at that time, he had 2-3 times loose motions with mild bleeding. So we advised him to continue the same medications for 2 more weeks and prescribed a capsule point to stop the bleeding. After 2 weeks, became normal and still continuing the Gulichari, Kashayam and the Mahadikta. So here I want to point some thing about the ulcerative colitis. So ulcerative colitis is a severe form of IBD with inflammation of rectal mucosa spreading from distal to proximal colonic segment with the symptoms of diarrhea, rectal bleeding, tenesmus, passage of mucus, and cramping abdominal pain. So this can be correlated to Rectadisara in Ayurveda. Our management is focused on healing the ulcers and restoring the normal functions of the colon. So in it was prevalence of UC was not to be high in Western countries, because nowadays it is rising incidence in India, topping the South Asian countries. So Pittadisara, Rectadisara, and Shogotpana Adisara features bleeding with stool, which occurs due to ulcerations to colonic and rectal mucosa. So according to Acharya Charaga, if the patient suffering from Pittadisara takes more Pitta vitiating foods and drinks, it will lead to Rectadisara. So this Rectadisara can be considered as an active stage of ulcerative colitis. So in Rectadisara, these are the symptoms like bloody diarrhea along with thirst, pain, burning sensation, fever, and inflammation, which are said in our Samhita. So it can be correlated to the active stage of UC. And in UC, the loose motions may occur due to the poor absorption of water and electrolytes caused by mucosal destruction and ulceration in mucosal surface of the intestine. The etiology in allopathy system, according to allopathy, they are telling that possible causative factors include genetic, immune system reactions, environmental factors, long time use of NSAIDs, smoking history, low fiber diet, appendectomy, psychological stress, etc. But in our system, impairment of Jadarakni causes various diseases of Mahaswada, that is Dietary. Here, Mandakni is the root cause of the Recurrent. So according to Acharya Charaka, intake of excessive sour, salty, pungent, alkaline, hot, irritant things, constant exposure to hot sun, fire and hot wind, and psychological stress with anger, depression cause Pitta, and the continuous intake of Pitta vitiating foods leads to Recurrent. And the complications are toxic megacolon, fulminant colitis, carcinoma, colon perforation, fissure in manner. Coming to the blood test and biomarkers, UC cannot be diagnosed through simple blood tests. Still, they are important to monitor the activity of the disease, complications, and outcome of the medicine. So, CBC to detect infection and anemia. Inflammation markers such as CRP and ESR, which will be very high in the active stage of the disease. But in our case, when he came, the ESR and CRP was low because he was under the steroids. LFT to screen the liver and bile duct, which are occasionally high in some people with IBD, because due to heavy intake of allopathic medications might lead to liver functional abnormalities. We need to check electrolyte panel to measure the level of certain minerals which can drop with the UC associated diarrhea. Vitamin B2 also can be checked if the small intestine is not properly absorbing nutrients due to IBD. Among the biomarkers, CRP in blood and a protein called a calprotectin in the stool are usually used to diagnose the inflammatory activities. Colonoscopy is used to view the entire colon and to take small samples of tissue for laboratory analysis. Instead of colonoscopy, nowadays we can do a flexible sigmoidoscopy also. And nowadays they are using a double contrast barium enema examination to diagnose, to differentiate UC and CD, that is ulcerative colitis and Crohn's disease, due to its ability to depict fine mucosal details, that is double contrast barium enema. And then CT scan of abdomen and pelvis may be performed if we suspect the complications from UC. So management in allopathy system is with the oral, topical and IV administration of antibiotics, aminosalicylate. Corticosteroids have been used to subside the active phase and to maintain the remission of the disease. But the drug resistance, drug dependency and side effects of those drugs are very high. Up to 60% of the patients with a severe UC eventually required a surgery, that is colectomy. Here in our case, Manasika bhavas like Shoga, Bhaya, Krodha, etc. are the directly positive factors of UC. In our patient, Viruddha Ahara Viharas and loneliness in his college life, made the platform to initiate the ailment. But about 2.5 years ago, his sister got married and went to her spouse's house, which made him more depressed and lonely. During this time, the disease sprouted out abruptly. So, in this case, there is a direct relation between his psyche and disease. Being a Pitta Prakriti, he was short-tempered and he was always with negative thoughts. So after discharge, we advised him to go for a proper psychological counseling to make him more positive, which will help him to maintain a healthy gut. Here, the learning points are, according to allopathy, there is no cure for UC, but the drugs they given often produce severe side effects and may result in drug resistance. Hence, there is a need for safe and effective alternative treatment. In Ayurveda, various treatment modalities of Recurrent is described and we are practicing it successfully. As always, the first line of treatment is Nidana Parivartana by avoiding Viruddha Ahara Viharas. Along with the oral medicines, Piccha is beneficial in different stages of Recurrent, UC, check bleeding and inflammation, etc. Very light and Satmaya diet is given initially to prevent the aggravation, important role in this disease process. So, Sattva-Vijaya Chikitsa should be included. Thank you. Over to all.
Thank you, Dr. Rani and Dr. Abdul. That was a very informative presentation. Now, over to everyone.
Hello.
If anyone has Thank you, Dr. Annie and Dr. Bindu.
Thank you.
And that was a very informative presentation indeed. And we have taken us through the whole condition of the patient. Now, if anyone has any more questions or any more clarifications or any more comments to add, please do.
Hello, Doctor.
Yes.
Can I ask one doubt?
Yes, yes, doctor.
Please mention the contents of the Pichavasti you have used.
Sure, doctor. Here we use the Pichavasti. Normally in our text it is said that Pichavasti should be prepared with the Pudavaga Vithi, but we prepared a Kashayam, a milk decoction actually, with adding the contents Mojarasa the Churnam. That is 5 contents: Yashti Madhu, Mojarasa, Lodra, Nada Kesara, and Kudacha. We made a milk decoction by adding 250 ml of water and 50 ml of milk, reducing it up to 250 ml of milk, and adding 20 grams of kalkam, the same kalkam, the Mojarasadi kalkam we used for it, and then adding 25 grams of honey, ghee 100 gram, ghee was Mahadikradam, and the rock salt 5 grams. This was that. And this we used in 4 to 5 cases before also, and it was very effective.
Just a quick add-on question. Why did you modify the classical Kuta for Pichavasti to this one? Why did you change?
Pudavaga Vidhi is very difficult, sir. That is why we Pudavaga Vidhi is a little bit difficult to do that. That is why.
So even this modified thing, there's a classical reference for that?
Yeah,
Any reference?
It's a reference from a PG thesis. I got this, and I prepared this and tested this, but it was very effective. That is why I continued.
Yes. It'll be good to share the PG thesis reference, so it becomes at least further validation, for the scholar.
Okay.
Yeah, thank you.
Okay, sir.
Hello, Dr. Annie.
Yes, doctor.
Yes, very good outcomes received. I have some questions on the diagnosis itself. I missed a couple of things because I lost internet in between. So my first question is, was a colonoscopy done?
Yes, doctor. Yes, doctor. We couldn't upload it. The pic we couldn't upload it. That is why it is there.
Yes. So from that, what was the stage and grade of ulcerative colitis? Was it an extensive colitis? Was it pancolitis, or was up to sigmoid colon?
Initially, the 2 colonoscopy was there. Initially, it was a pancolitis. And after taking the prednisolone for 1 year, he again took a colonoscopy. It was only sigmoiditis. Proctosigmoiditis, they have diagnosed it. Yeah.
And with that, was there a biopsy done to prove about the autoimmune?
Yes, biopsy also done. And it was, yes, doctor.
For an autoimmune behavior, was the biopsy done?
Yeah, biopsy done, and it was diagnosed as ulcerative colitis.
So when with this kind of a finding which you found on colonoscopy with an autoimmune behavior, inflammation, pancolitis, and then prednisolone, he was responding to prednisolone and a recurrence. Why did you choose to diagnose it as Raktatisar and not Grahani?
I think, doctor, it is the microbiota affected was on the aquasia actually. So Grahani means it's a full stomach based, So that is why.
Yes.
Yeah, it's aquasia only.
Because this I would like to understand and also hear from other colleagues if there is an opinion on diagnosing Raktatisar versus Grahani, IBD versus ulcerative colitis, because often we see that ulcerative colitis is extremely has a different behavior versus other kind of bleeding disorders. So especially when we try to do an intervention like Piccha Basti, it irritates the colon.
So at what point of ulcerative colitis should a Pichavasti be done? And we try to ensure that the ulcers are healed. So that was one question, that how to differentiate ulcerative colitis versus Grahani Raktatisa, and would be at this point of time when he came with a local infection and or local inflammation, which is why he responded very well to Pichavasti.
Yes.
And if we refer back, as you shared reference of Pichavasti, the indications are for controlling because of its slimy behavior, which is there. So when we would have a patient with a pen colitis or extensive colitis, would Pichavasti be contraindicated?
Yes, because it will be irritated, very much irritated. Yeah.
Yes.
And we will normally IBS is correlated to Grahani, no?
True, but different types of Grahani stages, right? From Vataj, Pittach to Sannipatach with Raktaj involvement.
Angraha Grahani
So,
also it is.
Raktatisar, maybe in my view, would be limiting the diagnosis, and in certain stage of ulcerative colitis, we may not be able to do exactly the same. So maybe we will have to understand the stage of ulcerative colitis and then plan on which line of chikitsa should we choose, Raktatisar or Grahani.
Okay, okay, doctor. Thank you.
Anybody else? Thank you, Dr. Jankana.
Yeah, Madam, Dr. Sankara, Madam, good evening. Good afternoon, Dr. Adi, Madam. So, coming to the point of Raktatisara and Grahani, Raktatisara, the dosha, dusya, swabhavas are in different stages. If I'm not wrong, you can correct me if it's wrong. Raktatisara means more of Vataja involvement. Vataja involvement along with Pitta Dusha, Samsarga Dushana Tattu Samanya Dandavarnayo. That is Rakta Pitta Subhava. Whereas in a Grahani part, there is a Paka happening where there's involvement of more Pitta associated with Vata. So that the slightest differentiation of dosha involvement makes us differential diagnosis between Raktatisara and Grahani, where the treatment is totally different. In Raktatisara, it says it has to be done in form of Grahi, Stambana, and Urdhva Anulomanam. Urdhva Anulomanam. Whereas in Grahani, it is Grahi, Stambana, and Ranaropaka. That is Pachana, Grahi, and then Anaropa. So from this, we can understand that the dosha swabhava between both is different. So it can be easily dealt with our diagnostic procedures. Example, the colonoscopy. The position of the ulcers, where it is in terms of the small intestine, large intestine junctions, or in the end part of the large intestines. So those are the areas where we can also get a lead on which active doshas also can be predominant. For example, if it is in the upper part of small intestines, Ama, Pakwash, and Madhyagam, then it is more of a Grahani Subhava. If it is the end part of the colons, which is the Pakvasya, then it is more of Vataja Subhava. So those are the points which we'll have to take in considering coming to a diagnosis, is what I feel.
Okay, okay, doctor.
Anybody would like to comment on Dr. Rakesh's keen observations?
Yes, so Dr. Rakesh, that is useful. So considering that, if the lower part is something which is involved, would doing a Pichavasti irritate the colon? When would you do a Pichavasti? Would you do it in an acute presentation or would you do it in a chronic presentation? Well, Sushruth has told to arrest loose motions. It has not been indicated for bleeding.
Correct. Correct.
Right. So
always Vasti is already always indicated in a chronic phase. In acute phase, it's only Shamana. It can only be Shamana where you give Grahi, Stamana drugs. Maximum you can use is an infiltration with Grahi Dravyas. Infiltration so that the Rakta Stamana occurs. That's the maximum thing, like a Pichu or a something, some local therapies which will do the Grahi or Stamana Dravyas. That's it. Once the active presentation is finished, Agni Deepana occurs when there's an Anulomana happening. Basti is only keen on for the ulcers reduction. Ulcers reduction where the Pitta Paka is controlled. So the Pitta Paka has to be controlled, that Lakshan of Pitta Paka has to be achieved. Then only we can do the Basti, is what I feel.
Yes, so since the patient has benefited and great control, which is indicating to a point that probably at this point of time when he came, he would not have that active UC, but more
Yes.
of a local infection or a
Yes.
sigmoid involvement to which he responded so well.
So well, yes.
While he
Actually,
had
doctor,
ulcerative
we
colitis,
have
a
done
known case.
Initially, we have done medicines to arrest the bleeding, and then we have done Snehapanam, and after that only we have done the Sanilomana and also Pichavasti. Okay, I think at that time, to complete cure of the ulcers, we have done Pichavasti. But in text,
Understood,
yeah, in
But Dr. Addy, I have a question in that.
Yes.
Sorry, I have a question in that. It clearly says either in Rakta Tisara or in Grahani, Virechana is totally contraindicated.
Okay.
It clearly
Yes,
says
doctor.
Virechana
That
is
is-
contraindicated.
Yes, sure.
And
doctor.
we have done Virechana with Avipati Churnam. It's not Ablomna, it's Rechana.
Only
It's a
20
Rechana.
grams.
So,
Yeah,
yeah,
because
it's a Rechana.
Snehapanam was done. No, that is why we have done a Mridu Virechanam. Otherwise, it is contraindicated. Yes. And contrary to this, this Pichavasti is indicated in Raktadisaram actually. So I think there will be some bleeding checking effect with the Pichavasti. It will be there, I think. I think it can be used in active stage also, I think. What is your opinion, doctor? Because it is said in Raktadisaram in our texts.
In Rattatisara, Pichavasti is told only after Ama Pachana or after the Tammana, wherein the effect of Pitta is there in the localized areas. That time Basti is done. But in active bleeding, it is only Shamana.
In our case, after Virejana, in that Virejana Vegas, there was no bleeding at all. So that means we arrested bleeding and then we started doing Bastis.
Okay.
Okay, so I think there is a important point coming up here on this conceptual thing. I think we should park it here. Maybe take this offline and then come up with the note to include these observations as well. Would anybody else like to comment on what has just been presented by Dr. Ani, then Dr. Jankana's, Dr. Rakesh's comments and this discussion? Can please jump in.
Thank you, Dr. Bindu and Dr. Ani.
Thank you. Thank you, doctor.
Yeah,
Actually, this case was referred by Dr. Indu. Dr. Indu knows this case. Thank you, Dr. Indu.
Second, Dr. Indu, are you commenting before Dr. Bhatt? You had begun with some comments?
I was confident that this ulcerative case would be successful in Dr. Ani's hands. So the inquiry came to us, and due to some financial constraints the patient met, we referred it to AVHE. But he was happy. At the end of the treatment, he was very happy, and he was in constant touch with me also. And I was also aware of the treatment plans and everything that was going on.
Okay. Thank you. Any comments on the medical side? So right from the beginning, since you're part of the medical plan, there's no other observations on the discussions that have just happened now.
No, sir, I was just listening to that, because always when in such cases for a differential diagnosis, it always creates a second thought. And as per, I agree to what Dr. Rakesh said, because depending on the sthana, we have to analyze the dosha, and according to that, the treatment plan will vary. And Pichavasti cannot be considered as a Paka treatment for all cases of ulcerative colitis. That is what I understand from discussions and through reading papers.
Okay. Okay. Dr. Riaz, if quickly, otherwise we'll go to Dr. Thank you, Dr. Indu. Dr. Riaz, would you like to comment, or we'll go to Dr. Bhima Bhatt?
No.
Okay.
No.
Thank you. We'll come back in subsequent discussion. Dr. Bhatt, please, once again, I'll just add back.
Yeah. Good afternoon to everybody. And it was a very nice presentation. Atisara, when we say Atisarana, means it is actually loose motion. Vataja, Pittaja, Kafaja, all these things are to be taken care. And also Raktaja, Raktatisara, when we can very well say. Usually the origin of Atisara is, in the large intestine. When we speak about the Grahani actually is, Grahani is a place that is a, duodenum. And in Grahani itself, the disease starts, that's why it is called as Grahani. And then in that, the ulcerations are there in the small intestine, throughout the small intestine. Probably ulcerations are less in large intestine. When we do Piccha Basti, this Piccha Basti, the extent of entry of the Piccha Basti content is only up to the cecum. Further, it doesn't go at all. It doesn't go. So Piccha Basti, if at all this Piccha Basti is done, whether the ulcerations were there only in the large intestine, this is one thing. Second is, what is the color of the blood? When it was coming along with the stool, how many times it was coming? How many times? Every day, 6 times he was going, all the 6 times he was having. What is the color of the blood? By color of the blood also, you can very well understand from where the blood is coming. Whether it is coming from the small intestine, whether it is coming from the large intestine. If it is coming from the large intestine, it is slightly reddish in color. If it is coming from the small intestine, it may be little darker in color. And what is the total quantity of the blood which was coming out? And as rightly Dr. Jankana told, colonoscopy is very, very important actually, and we will be able to understand where exactly the ulcers are there. So this is the thing. And of course, when we give Ayurvedic Churna or any other milk, even milk, we have seen ulcerative colitis cases are very many with us. When we give milk, we cannot give milk at all, because milk itself is going to cause this. Of course, in Pakvavastha, when the whole this one has stopped, we can give it. What I feel, Ayurvedic Churna also we cannot give during that time. And Virecha, of course, we cannot do it as he told, as Dr. Rakesh told, we cannot do it. But anyway, this results which you have got is really wonderful. And but we have some doubts about Piccha Basti, whether it goes into the small intestine, if at all the ulcers are there in the small intestine.
Okay, doctor. The quantity of Piccha Basti.
Yeah. Sorry, madam. Sorry, I'll clarify that. Sir, whenever we do a Piccha Basti or any Vasti for this matter, irrespective of anywhere it goes, Acharya Shushruta clearly says, just like Surya Kirana, which is very miles away, has its effect onto the earth. Similarly, the drug, what we give, as in the Kashaya, has its action on its Virya and Prabhava, which means if a medicine is given in one point of time, that Virya is sufficient to travel to the entire Ama Pakvashaya. That is still Amashaya till the Pakvashaya. Just like we nurture the roots, it will go till the tree top. Similarly, just to tell that even though we give medicines, it may just absorb for 1 minute, or it may only hold on for a minute or two, but still that Virya effect will be there, which will have its effect on both Amashaya and Pakvashaya, Ama Pakvashaya also. Hello.
Yes, Dr. Bhatt, any comments? Otherwise, yeah. So I think this is interesting. I'm sure that what you told is agreed upon by everybody, Dr. Rakesh. There's no. Doctor, any response to what has been told? Any other comments from your side on this?
Sir, your question was the color of the fishes. The color was blood. Not fresh. It was not fresh blood, but it was not very dark. It is reddish brownish color. And in the early morning, it was clear, but from second defecation, it will again become brownish and reddish color. Yeah. In the beginning, it was like that.
What are the quantity of what are the quantity of the blood?
Quantity means it is mixed up with the fishes, and he is a normal food was given to him. So 6 times motion means the motion will be very less. So in that the blood was mixed up. It was not separate actually. It was mixed up with the fishes. Brownish reddish color.
Yeah, that is there. In if at all the place, if it is in the grahani, that is in the small intestine, then what happens? There will be muhur baddham, muhur dravam in grahani. How differentiation of grahani, pittaja grahani, raktaja grahani, raktatisara. Raktatisara, mainly the large intestine is involved. In grahani, mainly the small intestine is involved. And in mainly what we have seen, what is my observation is a Piccha Basti, when we give with Mocharasa, it is very effective in case of the Raktati Sara, of course, what you have diagnosed, but in Raktaja Grahani, it may not be very helpful because the symptoms are totally different from, the Raktati Sara and also Raktaja Grahani.
As you well said, sir, I also think that this Piccha Basti has a more localized effect than a systemic effect, I think. And because of its slimy nature and the prabhava of the medicines. So actually I wanted the Parijaraks to ask patient to hold the Piccha Basti as long as he can. So he held it at least 15 minutes in the 3 times.
Yes, yes.
Very interesting point.
Even Takrabasti we have done. Takrabasti also has a very good effect, in such condition. Piccha Basti also has good effect only in the large intestine. But if it is there in the small intestine, it is difficult actually to give Piccha Basti. And the effect is, of course, it may have a long-term effect. I don't know exactly. Long-term, it may get absorbed and then, it goes to the system and then it affects. But the effect will be little, it may take longer time, what I feel. Like, yeah. Thank you very much.
Any other center?
Annie ma'am, good evening. I have a question here.
Good evening. Yeah.
Ma'am, if it was not Piccha Basti, which other Basti you would choose? I just want to learn from you that instead of Piccha Basti, what you will choose in this case.
I think in this case, as Dr. Sangana said, it will be irritating. All other Bastis can be irritating to the flora, mucous membrane. So only Piccha Basti and the Navasana Basti can be done at this stage, I think. Over to Dr. Sangana.
Yeah, that is right. In fact, I still carry a different point of view from the experience that I have had dealing with acute and acute on chronic ulcerative colitis patients, that when a patient comes in a bleeding state, although we are able to control it to an extent, administering Basti itself is very risky, is very difficult. While healing ulcers, achieving to do that is all fine, but I still carry a view that when there is Raktatisar, which is of a different origin, like an infective origin or local origin, and not as intense as ulcerative colitis, Piccha Basti would be effective, because ulcerative colitis comes up from the whole systemic pathway rather than just the colon. Colon is a manifestation site. We are trying with Piccha Basti to heal the ulcers. That could give a temporary relief, ulcerative colitis. So Piccha would be more effective rather in some kind of bacillary or those kind of dysentery and infective colitis condition rather than ulcerative colitis is something that I feel from the experience that I had of handling patients, but would still park my view and not hold on that, would do a lot more homework and come back. And also the second point that still is running in my mind is that you had prescribed multiple medications. There was point capsule, Ulcent, Kashayam, Snehapanam, Piccha. So how did you plan that? Like for each of those, planning those things, that this thing to achieve this, like this objective of treatment. At what point of treatment did you find that this approach was more effective than the other one? Like point and Ulcent also could have controlled and got that hemostatic effect. Did that give? Did Snehapanam give or did Piccha give? Because your core focus was on like Piccha as a promising agent for ulcerative colitis. So between these things, what did you think had a greater role?
Yes, doctor. Actually, it's a deep-rooted disease and he came for root cause management. We wanted to do a complete detoxification, like Shodhana treatment itself. So before Shodhana treatment, we have to arrest the symptoms. We needed to arrest the symptoms. For that, I have done this Takradara for reducing the Kapha-Pitta Shamana initially itself, and then some medications that will arrest. So Dietary Kashayam that will arrest the frequency of the bleeding, and this what you call sesame seeds with milk that is very well good for the checking the arresting the bleeding. And also there was burning sensation in the stomach and also on the rectum. So for that we have given this Alsan, and also Kudajarishtam for if there is any undergrade fever, that will Kudajarishtam will arrest that also. For that I have given because we have very less time now. So within 4 or 5 days I plan to arrest the bleeding and reduce the symptoms. So for that I have added all these medicines, and it was a little bit successful also.
And did you see any change or any acute irritation when you planned for Arishtam? Would you have planned Arishtam?
Actually, I have given this Arishtam with the honey, actually. 25 ml Arishtam with the honey I have given only 2 times in a day. Only hesitantly I have given. And because of the ulcerations are in the Pakvashaya, that is why I given the Arishtam. If it were in the stomach, I have not given the Arishtam.
And one more connected question was on tapering of steroids. You, within the period of 21 days, you had asked to taper and stop. Did you see any change or any flare-up when steroid was stopped?
Actually, initially there was no flare-ups. Like when we reduced it to 20 mg to 10 mg, there was no flare-ups because I expected something, but there was no flare-ups. Maybe because the day before our treatment, up to the day before our treatment, he was on high dose of non-veg and so many junk foods he was taking because he was his marriage was on the previous week. So so all of a sudden we stopped all those junk foods and non-veg foods, spicy food, etc. By itself, he got a very good shamanam in this his symptoms. So I think there was no flare-ups. We haven't seen, even if I expected this, there was no flare-ups.
Because we had recently seen a case where, like tapering of 5 milligram, we started doing on alternate days. So the day where there is a break in steroid and where higher dose is tapered, we could see that there was a bleeding initially for 2 to 3 days, and then it subsided and was completely controlled. So that initial in-between period of tapering is important to plan our treatments.
Yeah, considering this in mind only, I have prescribed all these medicines together to control it. And actually we have tapered it so fast just because as the wife was insisting this. to taper the allopathy medicine so that they can plan their baby. And that's so by Ayurveda treatment, they wanted to stop the allopathy medicine. That is it.
Thank you. Ramurthy Nagar, then Dr. Vrinda, Dr. Amrita, any, Dr. Reshma, Dr. Anagha, any comments from you quickly? Dr. Rahul said he's in a, engaged in something very critical. He'll watch the recording later. Anybody else would like to comment? Ramurthy Nagar team, any comments from your side? If not, you can just say no so that we know.
Good afternoon. Ma'am, there is a small doubt, ma'am.
Yes.
Ma'am,
Yeah, go ahead.
After the treatment, after Piccha,
Yes.
if you want to see the reports like colonoscopy, if you want to take colonoscopy report after the treatment, when we can advise, ma'am?
In my practice, I think only after 3 months we can advise in a colonoscopy, because colonoscopy is also an invasive procedure now, so that may affect the flora or the mucous membrane adversely. So I will recommend only 3 months after, because now we have arrested the symptoms only. I can't claim that I cured the disease, So only after 3 months we can advise. Because it's a chronic disease, we need to take that kind of time to cure the disease. I think it is needed.
Okay, I'll just add 2 more points because we are running against time. So, Dr. Ani, going further from the colonoscopy, the fact that when was the earlier colonoscopy done? We need to know that part, at what stage. Anyway, that is one piece, because it could have changed by the time the patient came for treatment. And also linking that in one sense to the treatment plan. I mean, there were different commentaries on which part of the colon is inflamed and so on. So there is one thing which is there for us to go. But the other key thing which I wanted to bring is that there are other biomarkers indicated for UC and Crohn's. So I wanted to ask anybody in any of the centers, can you just say which are the biomarkers indicated for UC and Crohn's disease? And has
Fecal
anybody used this in
calprotein.
the past? Yeah.
Yes, sir.
Fecal calprotein.
Yeah, calprotectin.
Calprotectin.
So who has used calprotectin till now in any of the centers can put up their hands, please? It'll be interesting to know. Great. Yeah. So why did we not do calprotectin without doing colonoscopy? It's a very clear biomarker for this particular condition, right? So before and after, if it is not done, there's something very easily to prove the fact that these inflammation that IBD has been brought under control. Right. So any thoughts, and we can still do it.
Yeah.
Calprotectin is for old reports. Yeah.
Calprotectin is for IBDs. That is for CD, Crohn's disease and ulcerative colitis. We can indicate, we can detect calprotectin. It is not very diagnostic of UC, I think. So colonoscopy is more specific, I think, sir. So they have done colonoscopy earlier. In the initial stage,
calprotectin is very much indicated as a biomarker for ulcerative colitis.
Both, sir, both.
Yeah,
for CD also it is there. Yeah.
Correct. So at least we could have used that to show that the inflammation has come down. Apart from ESR and CRP, and even the ESR CRP changes from beginning to end, was it clearly indicated?
Yeah.
There is a change.
Actually, when he came, ESR and CRP was normal only. Maybe because he was using prednisolone.
Prednisolone. Okay.
Yeah.
Okay.
And he was done the colonoscopy 2.5 years before in the initial stage of the disease. And after 1 year, again, he has done this colonoscopy 2 times.
Okay. Anyway, so I think to establish very categorically, one is the functional improvement, but some of these biomarkers, if we were to add, it would have been helpful, is one comment which is there.